Now is Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Hey, good morning.
So that demographic, there's a low percentage of them even getting the first two doses. How is that demographic doing health-wise when it comes to COVID?
Well, the perception is that, oh, these kids hardly get sick or whatever. But if you look at the total numbers, it's 2.9 million cases of COVID in that age group, 6,700 hospitalizations, 739 got MIS-C. It's that multi-system inflammatory syndrome, very serious disease, and 95 of those kids have died. So, it's not that benign. And, only 30% have had the first two doses. But the booster is now available, and hopefully people will get their kids vaccinated.
Doctor, we didn't think we'd be talking to you again. We thought we were done talking to Dr. Murphy, but it seems like everybody knows someone who's got COVID right now. Things seem to be on the rise, but hospitalization's still pretty low. Compare all this to what it was in January, doctor.
Yeah. So hospitalizations, and you've been seeing this, and the death rate have been increasing by really large percentages. However, if you look nationwide, you look around the country, 24,000 hospitalizations, but in January it was 160,000. So we have to put it into perspective. So the number of hospitalizations and the number of deaths, although they're going up by significant percentages, they're starting so low that the actual numbers are not that high.
City and county health officials seem split on the prediction for COVID in the fall. Why is that, and what are your thoughts?
We don't have to wait for fall. We're in the middle of another huge wave. The numbers are going up, but these numbers are not reporting most of the people who are getting sick because they're testing themselves at home, and those do not get reported. So just multiply everything by some number. Maybe it's 5 times the number. We don't really even know, but more and more people have it. We do know the hospitalization rate, and we do know the death rate. So, and those, like I mentioned, is not that high.
How long is your immunity if you get COVID, and how many times can you get it in a year, say?
Well, it basically is like the other coronaviruses out there. People were getting colds year round. Remember, people had summer colds, they had winter colds, all those little colds. Many of those were from coronavirus. People could get a couple times per year. The same thing is going to happen with this. And with Delta, we had people get Delta in December, and then they got Omicron, within a month later. They had it again.
All right, real quick on monkeypox.
Oh. Monkeypox. This has really just kind of come out of the blue. There's cases reported everywhere now, all over North America. You have the one case in Massachusetts, but there's another case in New York being investigated. There's 15 cases outside of Montreal suspected right now. It's really a worldwide phenomenon. Even Australia has a case. It seems in the United Kingdom anyway, it seems mostly in men who have sex with other men. So there's something, it's not a sexually transmitted disease, but just, some place where where contact is made, close contact is made between people, because it's not a sexually transmitted disease. But, who knows what is going to happen with this, but this is a watch out. The United States government has just purchased $119 million worth of vaccine for monkeypox, with $180 million more as an option. So somebody's worried about this somewhere.
Well, it's good to see you, Dr. Murphy. Hopefully we won't have to talk to you again on a regular basis, but it's good to see you nonetheless. Thanks for being with us. Take care.
Thanks,
Take
doctor.
care.
Let's get a check of the weather, Paul.
Yeah.